It is time to talk about sclerotherapy, the injections to make the spider veins disappear. How do they get these spider veins?
It's very common for females more than males. Usually estrogen starts to weaken out some of those veins. And then if they've ever had babies, stretches those veins out, they become a little bit tired.
So these are great examples of telangiectasias. Telangiectasias are small little spider-like vessels.
There's two types of sclerotherapy agents that we usually like to use. There's a group of osmotic agents, and then we also have detergents, which is not like the detergents you have at home. And I'd like to know if she's ever had any pain, if the veins cause her some swelling in her legs.
Once if it's less than 1 millimeter, it's going to be a spider vein.
Is sclerotherapy a monster big part of your business, a small part of your business?
You have a big population of patients over 50, that could be a big part of your practice.